I'm Dr. John. FJ is interning at my office, and today we're going to describe how to briefly and accurately characterize patients in the SOT technique. SOT is defined by having three categories basically, and it's important that the practitioner be able to accurately determine what category a patient is. Too many times doctors benignly place blocks not knowing that they can do a great amount of damage if you block the patient incorrectly. So these are not benign. Just because it's low force doesn't mean it's benign and you can't hurt someone. You can really, mess up somebody's physiology if you don't categorize them correctly. So it's really important. So SOT, there's basically three categories. Category 1 is characterized by heel tension, a unilateral heel tension, associated with dural tension. And the dural tension arises out of incongruent motion between the sacrum and the occiput, thus affecting the flow of cerebral spinal fluid and promoting dural tension. These patients may or may not be in a symptomatic state. Category 1, though, is a place where people will tend to live. You are a respiratory being, and Category 1 works to synchronize craniosacral respiration. So Category 1, we'll talk about that in a little bit. Category 2 can be a classic lower back patient. Category 2 is characterized by patients who have a difficult time transitioning from a sitting to standing position. There are also people who, as they move, tend to feel better. Category 2 may or may not involve sciatic nerve involvement. So it's important to make sure you accurately use objective findings and not just symptoms to differentiate between a Category 2 and a Category 3. We'll talk about that in a second. A little more on Category 2. Category 2 is characterized by a weight-bearing weakness in the sacroiliac area, ligamentous laxity, instability, causing the foundation of the spine, the weight-bearing aspects of the spine, to be overwhelmed. And what's going to happen there is the body is then going to recruit muscles beginning around the pelvis and then migrating upwards, even affecting the lats, the first rib, the scalene, sternocleidomastoid, all of these things. So Category 2 becomes a global involvement. It's not just low back, it's global involvement, the body compensating for a lack of weight-bearing integrity. Glandular system, it's far-reaching. Category 2 is far-reaching. It's not just a structural misalignment. Two of your most guarded possessions are your ability to move and your ability to think. And Category 2 completely affects your ability to move. And every Category 3, unless they've been mashed by a freight train, every disc issue has its roots in a Category 2, which is an unstable pelvis. So it's really crucial. 65–70% of my new patients coming in the office are Category 2, have some degree of Category 2 involvement. Really important. I can't emphasize Category 2 enough. Category 3 is straightforward. Pretty much you're going to have disc issues. Category 3 is characterized by sciatic nerve involvement. The patient is usually going to demonstrate some degree of antalgic posture. If their sciatic pain is on the right side and they're leaning to the right, that tends to be more of a posterior medial disc involvement. They're tougher to deal with. So if you have sciatica on the side of the antalgic lean, okay, those are tougher. Usually posterior medial disc involvement. If they're leaning away, if I have right sciatica and I'm leaning to the left, those tend to be more of a posterior lateral. They're easier to deal with, okay? So antalgic forward lean as well, they'll usually involve a more posterior medial disc as well. So Category 3, disc involvement, specific blocking for that. So what we're going to do is teach you how to, not only through understanding some of the symptomatology that's going to be demonstrated, but you got to have objective findings that are truly going to differentiate what's going on here. Okay, and it's real quick, it's real easy, and we do this scan with every new patient. We scan them for these three categories. We listen to what's going on with them, we take an accurate and extensive case history, and then we'll proceed to give them a great chiropractic exam that's going to show us where their subluxations are.